New heart guidelines. Early cholesterol testing and proactive treatment. Major medical organizations are now recommending cholesterol screenings begin in childhood, around age 10, alongside updated risk assessments and more. Aggressive treatment guidelines to combat cardiovascular disease. The updated recommendations, released jointly by 11 medical associations, including the American College of Cardiology and the American Heart Association, represent a significant shift in how heart health is managed, emphasizing prevention over delayed intervention. Why early intervention matters. Cardiovascular disease remains the leading cause of death globally, and these new guidelines aim to lower those numbers by identifying risks earlier. The old approach relied on a 10-year risk assessment. The new standard now includes projections for 30-year risk, giving patients and doctors a longer-term view of potential health issues. This is critical because heart disease often develops silently over decades, and early action can dramatically reduce long-term damage. The PREVENT Calculator, a new standard for risk assessment. The guidelines introduce PREVENT, a new cardiovascular risk calculator built on data from over 6.6 million people. This tool is designed to estimate the probability of heart attack or stroke over the next 10 and 30 years, offering a more accurate picture of individual risk than previous methods. The key advantage is its ability to predict long-term consequences, even in younger adults who might otherwise appear low risk. We can now tell patients that while their risk over the next 10 years is really low, their risk over the next 20 to 30 years is quite high if they don't change habits. Roger Blumenthal, cardiologist at Johns Hopkins School of Medicine. Key cholesterol benchmarks and treatment thresholds. The updated guidelines also clarify target cholesterol levels. Low risk. Focus on lifestyle changes to maintain LDL cholesterol under 100 mg/dl. Borderline intermediate risk. Consider medication to lower LDL levels. High risk. Aggressive treatment, including statins and lifestyle changes, to push LDL below 70 mg/dl and ideally closer to 55 mg/dl. Additionally, a one-time test for lipoprotein, Lp(a), is now recommended. Lp(a) is genetically determined and can significantly increase heart disease risk even if other cholesterol markers are normal. The rationale behind the shift: these changes reflect a growing emphasis on proactive intervention rather than waiting for symptoms to appear. As Dr. Blumenthal explains, the goal is to follow a similar approach to blood pressure management, where medication is considered if lifestyle changes don't yield results. The guidelines acknowledge that early treatment can prevent decades of silent damage, even in individuals who may not currently feel at risk. The new heart health recommendations represent a substantial upgrade in preventive cardiology, emphasizing early detection, long-term risk assessment, and aggressive management of cholesterol levels to reduce the global burden of cardiovascular disease.